This is our friend Dreamer. You know, sometimes, to make your body better, doctors may have to perform an operation. It might seem scary, but it's not, and Dreamer will show you the entire process. Before your operation, nurses need to get you ready, and that's done in the holding area. You won't be alone here. 2 grown-ups from your family can be with you. While here, a nurse will make sure you have hospital clothes. They'll also check your height and your weight. Then they'll make sure you're wearing a bracelet just like this. It has your name and birth date on it. The nurse will also check your heartbeat with a light-up Band-Aid and use a stethoscope to listen to your heartbeat and check your breathing. Then they'll take your temperature, and after that, they will use this device to check your blood pressure. It holds your arm tight and snug, like a hug. Once you're done with these things, the nurse will give you a warm blanket. Plus, you'll have a TV to watch and things you brought from home to play with. Next, you'll meet the hospital staff, an anesthesiologist who gives you sleepy medicine so you're safe and comfortable during the operation. There's also the surgeon. He or she will be the one who helps your body. Sometimes, the surgeon may want to look at the part of the body they want to help. They might even draw on it with a marker. This is so they'll know the right place to help. The anesthesiologist and the surgeon may both ask you questions, and your family may have you sign papers. And if you or your family have questions, they'll both be happy to answer them. Last but not least, you might meet what we call the child life specialist. They'll work with you and your family to make sure you're as prepared and calm as possible. What the child life specialist really loves to do is play. So if you're nervous, they know all sorts of ways to help you stay relaxed and have fun. The last person you'll meet from the holding room is the OR nurse. This nurse will help you get to the operating room, which is easy because the bed has wheels. On the way to the operating room, you'll notice all the doctors and nurses are wearing hats or masks. This is so they don't spread any germs. In the operating room, you'll meet all the people you met in the holding area. You'll also notice a lot of doctor stuff. We'll look at what some of it is. There are big lights, so doctors can see really well, but they're turned off when you get in, so they're not too bright. There's a lot of doctor TVs. They help keep track of your sleepy medicine and your heartbeat. Someone always stays next to them to watch them. You might also see the light Band-Aid from before and an arm hugger. You'll also get 3 ooey-gooey stickers that go on your body. They might tickle a little, but they're used to check your heartbeat and breathing. Then there's the mask. It looks something like a jet pilot would wear. This is how most kids will get their sleepy medicine. But if you already have a medicine straw, you'll use one of those instead. Either way, the medicine works quickly. Most kids can't count to 5 before falling asleep. The next thing you know, you will wake up in the recovery area. Another nurse will take care of you here, and 1 or 2 of your family members will meet you. You might have those ooey-gooey stickers, the arm hugger, the light-up Band-Aid, or the medicine straw with you. But these are only there to check on you and make sure you're okay. And that's it. After your surgery, you may have to stay at the hospital a little longer, or you can go home. But either way, you'll be better, just like Dreamer here.